Like and subscribe in the next 5 seconds, or this will be in your bed tonight. Doctors of Eye. What is the most bizarre issue you've seen a patient trying to hide or mask? A patient came in with chest pain. Said they'd fallen and hit their chest on a table. X-ray was performed to evaluate for a rib fracture or collapsed lung. The X-ray instead showed a long metallic foreign body in the left chest, within the heart. When questioned further, the patient admitted to lying, and that they'd actually shot themselves in the chest with a nail gun. The wound was not bleeding nor really noticeable. They were taken to the operating room and did quite well after open heart surgery. Good thing it wasn't an MRI. Sent a male patient into the bathroom to collect a urine sample. Took him much longer than expected. He misunderstood and gave a semen sample. Nurse, sir, we needed a urine sample. This is semen. Patient, you wanted my urine? Weirdos. Not sure if this counts as hiding, but a patient we recently had tried to play off a rampant staph infection as just some leg swelling. Turns out what he meant by that was he had a horrible infection in and around his genitals, something known as Fernie's gangrene. Do yourself a favor and don't Google that. The swelling had gotten so bad that his penis had literally inverted. He later told us that he had to pee with a 5-gallon bucket held up to his crotch because he no longer had any idea where the pee was going to go. Edit. Since so many people are asking what happened, he went to emergent surgery within hours, which is likely to be the first of many. Only way to get rid of an infection like that is debridement in the OR plus a shit ton of antibiotics. Somehow this guy had no systemic signs of infection, fever, low blood pressure, etc. So thankfully he should pull through. Last I heard he was likely to lose one of his testicles, but I don't believe they were going to have to remove his whole penis. I know it's fun to talk about how gross this stuff is, but it's a very serious type of infection. This guy's life was definitely in danger had he waited any longer. His penis had literally inverted. I think I would have gone to the hospital long before I found out a penis could invert. My aunt is a family doctor, so patients come to her with symptoms and she directs them towards a specialist based on her diagnosis. One day an elderly husband and wife came into her office, and when asked why they had come in, the wife responded, "His foot has been smelling for a while and I finally convinced him to come have it looked at." My aunt, not hard of smelling, concurred that his foot stunk. She asked him to remove his shoe and sock. When he removed his sock, the bone from his big toe fell out of his toe and onto the ground. Turned out he had a very bad case of gangrene that had eaten away the flesh of his toe. He knew something was wrong but was stubborn and didn't get it checked sooner. And my big toe hurts now after typing this. Had this happened to me too. A woman came in that was an IV drug user and all her veins had collapsed, so she used her leg veins and got a massive infection in her leg. It was black when she came in. She had put up with the pain for 6 months. Leg was amputated, but she was kicked out after she was found shooting up in the bathroom. Terribly sad. I once saw a high school age kid come in with a dinner candle stuck in his rectum. He reportedly was using it to reach an itch. Apparently the itch was in his spleen because that thing was deep. Mom told me the story, and how she had previously asked him to not itch himself with other things of hers. I didn't ask for any more details. I honestly think she believed that he was just really itchy. BTW. It prediction. Rectal foreign body stories. Lots of them. Maybe he was just trying to make it a little more romantic. My mother, the medical professional of our family, had a 13-year-old girl who was 9 months pregnant. In the midst of labor, dilated to 10 centimeters and crowning in the emergency tridge, swearing until she was black and blue that she was a virgin and that nobody knew what they were talking about. Her mother stood on the sidelines causing a commotion, demanding a real doctor make an appearance. Let's just say when the twins made an appearance 10 minutes later, they were all singing a different tune. I met a teenage girl with a full-term pregnancy ready to give birth, but her boyfriend insisted the baby was premature because they only had sex 6 months ago. After the baby was born, he just said that the baby grew really fast. Siri. From a nurse friend, guy came in with burns to his entire willy. He tried to say he got it by trying to shoplift a hot BBQ chicken from a deli down his pants. What he was really doing was fucking the chicken edit. What's with the McChicken comments edit too? Okay, I get it now. I will not be clicking on that link. Guy goes to a brothel and asks for the most kinky thing they can provide. Madam takes him to a room with a chicken. He's like, "Hey chicken," she says. "Take it or leave it." So he fucks the chicken. Week later he goes back with the same request. She brings him to a viewing room and there's a massive orgy going on the other side of the glass. He says to the old man next to him, "Wow, this is amazing." Old man replies, "You should have been here last week. There was a guy fucking a chicken." Do you have any medical conditions? No. What medications are you on? Proceeds to name at least 10 medications. Do you have any medical conditions? Sir. Nope. Are you on any medications? Metoprolol. So you have high blood pressure? No. The metoprolol keeps it down. A case of teenage pregnancy, where Madam Mama was present. Patient presented with amenorrhea and fatigue initially. Patient became visibly annoyed when the first test suggested is a pregnancy test. Patient and mother insisted that she never had sexual intercourse. Angrily, if I may add, even when the test result turned back as positive. No, you quack. I'm telling you she never had no sex. In the UK the girl has the right to privacy, even from her mother. In fact in this situation it's encouraged so she'd tell the truth. Teenagers can get contraception without parental consent too. Edit should have said without parental consent. Internal medicine ward outside of NYC. 55-year-old lady was mute in the ED, noted poor historian, but severely constipated, severe abdominal pain, needed rectal disimpaction and more than just an acute workup, so gets admitted reluctantly to surgery. Next morning on rounds she is talking a mile a minute, full of detail about her diet and symptoms and family, etc. Afternoon, back to mute, and back to abdominal pain and constipation. 2 more days, same pattern. Team is stumped. She is blown away that we can't figure out what is wrong with her, and we feel the same way. Labs, imaging, consult teams, all coming up empty. Strict ins and outs, strict dietary restrictions, everything we can think of. Janitor comes in by chance and is pissed he has to change the paper towel so many goddamn times in this one room. Seems like the whole floor is stealing them from her. Sure enough, PT has been consuming about 2,500 paper towels q 24 hours. Psych team comes for the obligatory consult, and of course she is mute. How do we get her to talk? 1 paper towel at a time. I think some poor intern got a paper out of that case. Hope she is doing well somewhere. I'm surprised surgery didn't figure out where the paper towels were going before the janitor. Not a nurse, but my mom works with nurses who have crazy stories. Here's 2 of them, both from a nurse's. A man came into the OR with a birthday candle in his penis. He had stuck it in there to surprise his girlfriend on her birthday, but when he lit it the melted candle wax stuck to him. This is probably the weirdest one I've ever heard. An old woman came into the OR with a high fever, abdominal pain, dizziness, etc. She's showing signs of toxic shock syndrome, like when you leave a tampon in too long. So the doctor decides to check the woman to make sure nothing got stuck up there. Sure enough, she looks up there and half shits her pants when she sees 2 beady little eyes staring back at her. The doctor begins to pull it out, to which the old woman responds, "Put it back." Turns out the old woman, well past menopause, had gone to a bad witch doctor to help her get pregnant. Her recommendation: put her, now dead, turtle up there for a few days and she'd regain the ability to get pregnant. I don't think anything can outdo the turtle story. I think I'm done with this thread. My cousin told me about a patient who complained about her nipple falling off all the time. She said she tried to glue it back on or use skincare creams to have it stick to her breast. Turns out she had, not sure what stage anymore, probably pretty bad, breast cancer. From what I remember, the tumor got so big that the breast skin was stretched quite a bit. Somehow that plus friction led to an open, not healing and oozing wound which extended to her nipple. Well, nobody there understood how she didn't go to a doctor or a hospital earlier. Keep in mind this happened in Germany. She had a job, health insurance and everything. My cousin's nipple fell off. She didn't have cancer. It was just a botched boob job. Ooh, I've got one. I had my nose straightened and septum shaved after I broke it like a dumbus. I woke up after anesthesia feeling like the fucking man. After about a minute of being awake, I tore out my IV, stood up, and started walking out of my room. Because I was going to walk home, about 3 miles, and finish that one mission in Heroes of Might and Magic 3. I walked past a nurse and she said, "You're bleeding." Haha. No, I feel amazing. I respond. I keep walking until I get to the elevator and I see my reflection in the metal. My face is bandaged up with blue-black bruising leaking out from under the white fabric. My eyes are bloodshot, and I generally look like shit. No matter. I wake up some time later, back in my bed with the IV inserted in my other arm and I am strapped to the bed. Turns out, I was on a morphine drip. That's why I felt like Superman. My parents start yelling. I am like, "What you flimmin' walkin' butt?" Turns out, I gave myself a concussion when I collapsed while waiting for the elevator. On the bright side, that is how I found out painkillers were amazing and that they would help me survive a year of intense manual labor when I ran away from home. On the downside, I was addicted to painkillers. I had emergency surgery once and they just went with morphine. No general anesthesia. I was awake the whole time. It was bizarre but I wasn't feeling any pain and was loopy as fuck. The odd thing was they let my GF stay in the room to comfort me, but she was so entranced by the surgery she forgot all about me and was watching the blood and gore. I kept trying to talk to tell her I wanted her to hold my hand but all that came out was ooh-un-goo-wog. Seriously so weird being able to think but nothing intelligible coming out. I was so frustrated and just wanted her to hold my hand. Haha. Anyway, after they have me waiting out in the lobby with my GF and were going to send me home under her care, I was still hooked up to an IV. The nurse says something about me going home and I was like, okay then I don't need this IV anymore, and just like you, I ripped it out of my arm and blood started spraying all over the place. The nurses and my GF were freaking the fuck out and I was like, what? I'm going home. Morphine is a hell of a drug. A great drug. D. I work in the lab and the pathology department gets the foreign body items removed from a patient's body after surgery. Recent one was a chorizo sausage. Glad I wasn't there that day. I admitted a guy for pneumonia, which was odd because he was young and strapping. No other medical issues. X-ray didn't look quite right. The pieces just didn't add up and so I started questioning him more closely. Me. Do you use any drugs? Patient. Drugs? That's disgusting. I'm no fucking druggie. I've never touched drugs in my life. I move on to other questions and suddenly, patient, look. Doc, I just want you to know I may have used cocaine once or twice years and years ago. I just snorted it though. That wouldn't cause this, right? Me. How long ago? Patient. Like 10 years. Maybe longer. Me. It shouldn't be affecting you after this long. Patient. More like 5. Me. Years. Patient. Like 5 months ago. This goes on forever, until he admits he just got off a massive crack binge the day before, where he spent the past 3 days in a hotel with some loose women smoking crack non-stop. He finishes with, "But I don't want you to think I'm one of those dirty druggies. No, I think you're the idiot who lied and was getting treated for pneumonia instead of getting the proper treatment for crack lung," which is what he had. Here's a tip. I genuinely don't care. I'm not your mama, your spouse, or your priest. Don't waste my time and endanger your health spewing bullshit. Whatever horrible twisted thing you think is too shameful to talk about. I promise you, I've seen worse. Oblig, not a doctor. On Thanksgiving I had a pain almost literally in my ass, but more toward my perineum. Ingrown hair / abscess type thing. Went to the since it was a holiday and I could hardly sit. When they asked what was the issue and where it was located, I said in a sensitive area. When they pressed further I said my perineum. Oh. The nurse replied, "Your taint." We all had a good laugh and I had my taint lanced. I once had a triple staph infection in different areas of my bum due to a compromised immune system. One of the little bastards was in the taint area. Pretty awful experience. But I couldn't believe how excited the doctor was about showing his personal lancing technique to his students. Glad I didn't have to watch. My wife said it was the most disgusting thing she'd ever seen. But the commentary from the doc sounded like he was watching his favorite TV show. He was positively giddy. Edit. And this is now my top comment. Actually not surprised. Haha. Nurse here. One time had a patient come in with insane intestinal trauma. Had to have his colon stitched up. Said he was fishing and fell, his rectum just happened to fall perfectly on a fishing pole. Must have been a wild night to be fishing naked. 1,000,000 to 1 shot. Doc, 1,000,000 to 1. I was a medic in the army. I worked for a while in a clinic that only saw trainees. There is a spectrum that all trainees that came to our clinic fell on. Malingerers, and I'm fine, but they forced me to come. We saw much more of the former, but I'll never forget this one patient who was on the other end. He was forced to come in after an injury, if I remember correctly. He didn't want to miss any training, but as we were listening to him tell us about his ankle pain, the PA I was working with interrupted him and asked him if his throat hurt because he sounded like his throat was obstructed. He admitted it did, but was adamant he didn't want to miss training for a sore throat. We realized after looking at his throat he had an abscessed tonsil. So he missed training? Not a doctor, but I'm sure the doctor would tell it. TLDR had an infection and had a hands-on experience I won't forget. I was 12 and I had an infection in my scrotum and tried to hide it, hoping T would just go away. I was walking funny and it eventually turned purpley. My parents got very worried and spoke to me about why I was walking funny. Finally had to show my mom my crazy swollen purple testicle and we went to the doctors the next day. While there I explained the situation. They needed to do tests, so I was given morphine and so they could ultrasound my nads. There was a super attractive nurse doing the ultrasound too. She got clear jelly all over my balls. It still hurt, but man, if that wasn't one of the first rock hard erections I ever had, I don't know what was. I was so weirded out by the whole situation. First I get an infection in my balls. Then I'm given morphine. Then get jelly slathered all over my balls. Then I see one of the prettiest girls in my life and she touches my disgusting morbid sack. I tried desperately hard not to smirk because it still felt kinda good. Also being ticklish. But every couple seconds I would giggle and smile, but then a quarter second later it would hurt and be painful. So it was a roller coaster. Especially for being so young. It went on like that for at least 5 minutes. Don't really remember what the problem was, but if I recall correctly I had a bacterial infection. But it cleared right up and I was fine. I think the only lasting effect from that was that women with short hair are still very attractive to me. Doctor and nurse, if you're reading this, thank you, but holy shit was that confusing. First I get an infection in my balls. Then I'm given morphine. Then get jelly slathered all over my balls. Then I see one of the prettiest girls in my life and she touches my disgusting morbid sack. Dude, say no more. A 60YF came in after falling asleep and rolling on a pincushion. She had 3 2-inch needles in her left shoulder on x-ray. Later found out she had been trying self-acupuncture. Oh god, no. Not a doctor but an EMT. I had a guy who tried to tell us he fell while playing softball and hurt his ribs and arm. This was 10 o'clock at night. Come to find out, he tried to screw his drug dealer out of some money and the guy chased him down with a bat and beat him with it. So I guess he was kind of playing softball. Not sure if this counts because I'm a pharmacist, but a patient came up to me and asked if there was gluten in cocaine because she has a gluten sensitivity. I suppose maybe someone somewhere tried to cut coke with flour. Still ridiculous, but I imagine she was quite serious. Edit. I actually have celiac and when I was in Amsterdam I couldn't find gluten-free edibles. One time a lady came into the OR with itching pain in her vagina. She said she had used some garlic as a natural way to fight a yeast infection. She didn't eat the garlic. That's a common thing that people do. Same as putting yogurt up your cooch. Not a doctor, but a friend is. Patient very hesitant with what was actually up, so went for x-ray. Unmistakable shape of a Barbie doll up his ass. So, emergency surgery, and it's removed. He comes to and sees his wife at his bedside. He panics, and when she goes to the ladies, asks the nurses not to tell her what's happened. She comes back in, and one of the nurses brings back the shit-smeared Barbie doll in a small plastic bag. Wife glares at him. I fell on it. What a nurse. I had a lecturer who told me about a homeless guy who regularly presented to ED claiming stomach pain. He would get an abdomen x-ray which showed a bunch of wire inside his abdo. He would be added to the next day's emergency theater list, get a hot meal and a bed for the night before hooking it the next morning and self-discharging before surgery. He had purposefully pierced his belly with a wire coat hanger and fed the thing inside himself so he could go around to hospitals and score a free hotel room for the night. This is somewhere with universal healthcare, so even though he was a regular and the hospital staff knew him by name, they couldn't refuse treatment and couldn't force him to have the coat hanger removed either. I'm kind of wondering why they're feeding him prior to surgery. Usually it's nothing by mouth. My late dad was a surgeon and, when he was a resident, had a middle-aged male patient come in complaining of pain in the rectum. They examined him and found a vibrator lodged fairly deep. When they asked him how it happened, he looked extremely surprised that it was there and then explained, I was lying in bed and it was on and vibrating on the bed near me, and it sort of moved on its own. Guess it found its way up my ass all by itself. Loved hearing emergency room stories from my dad, and it sucks that he's not around to tell them these days. Not hidden from us, but from her boyfriend. Came in with $9,000 in cash which he had wrapped in plastic and shoved up her hoo-hoo. Her vaginal acids disintegrated the plastic wrap and she had to be anesthetized to get it all out. I hope it was in 50s and 100s. I know the vagina is stretchy, but that much in small bills seems like it would be pushing it. Not so much bizarre as clever. I drug tested a patient who should test positive for opiates as I prescribed them. We do that too. The urine looked totally normal but the test came back bizarre. Had an insanely high specific gravity. Means there was a lot of stuff dissolved in it. Sample was positive for opiates but had zero confirmatory metabolites, what your body turns a drug into, in it. Otherwise test was totally normal. It took me a couple minutes to figure out how this was possible. The patient was selling their pills instead of taking them and didn't want to get caught. They crushed up the pill and put it into the urine. This made the test positive for opiates, but because it had never gone through their body the testing machine found no metabolites. I use the case to find the smart med student in a group now, lol. When I was in the hospital, there was a homeless man that was beyond drunk. This guy was next level shit. He had 2 doctors, 3 nurses, a cop and an orderly trying to keep him restrained. He thought he was forming coherent sentences, but the words "I'm not fucking drunk" came out several times, along with "I don't even drink alcohol." IT was rainwater. They kept telling him they would sedate him if he wouldn't stop his wild behavior. They couldn't because of his bowel. Every 20 minutes he would get riled up again and same shit all over again. Eventually, he admitted to alcoholism and the cop left and 2 doctors looked after the man. Dude even ripped out his IV. Anyone can rip out an IV. What's impressive is seeing a man rip out an inflated Foley catheter. Thanks for watching. Be sure to like and subscribe for more interviews.